All right, so I'm Michelle. I'm a physical therapist here at IRG in Edmonds, and I would love to know if anyone can hear me. So please write in the chat or unmute yourself to let me know if you guys can hear us. And when we know, we'll get started. Okay. Awesome. Thank you, Sue. So as I said, I'm Michelle. I'm a physical therapist here at IRG in Edmonds. And alongside me is Declan, and he can introduce himself.
I'm a physical therapy student at Pacific University down in Portland, and I'm doing a clinical rotation with Michelle for the next 5 more weeks, I guess.
So I am not great with technology, and I'm hoping you guys can follow along. So again, let me know if you are not seeing what I am saying, because we have a presentation put together for you. What we are going to start with, let's see. What we're going to start with our quick little overview of just who we are, IRG, and physical therapists in general. We're going to go over balance and a little overview of falls and what can lead to falls. Then we're going to talk about what can we do on our own and with others to help ourselves prevent any kind of falls. And then we'll go into more solutions, exercises, and then at the end we have plenty of time for any questions that you might have. All right. So, like I said before, we're from IRG Physical and Hand Therapy, and we are located all over pretty much Western Washington. I'm located here in Edmonds, so just north of Seattle, but we have clinics all the way down towards Olympia and then all the way up towards Anacortes, everywhere pretty much in between. So you can always reach out and look for your neighborhood clinic. So we provide physical therapy services, hand therapy as well. We have at specific clinics nutritionists and dietitians that can talk more about nutrition and wellness overall. We also have athletic trainers and people who specialize in sports performance more specifically, as well as workplace safety, injury prevention, and what we call the industrial athlete. Because there's a lot of things we have to do in our everyday, not to mention just sports-wise, where it leads to us needing to train ourselves with PT. So we also have some of our more niche services. So that includes women and men's pelvic health, vestibular therapy, as well as fall prevention. Those two sometimes go hand in hand, but they're also very different services. Lymphedema management, more of a holistic health, including myofascial mobilization, custom splinting, especially for those who are seeing our hand therapists, aquatic therapy, and then we also have certain practitioners who focus on golf much more specifically. All right, so what do PTs and OTs do? A lot of times there's a lot of overlap between the two, and we're always wondering what's the difference. And there is a difference in the schooling and the training that we have, but also how we look at our treatment styles. With physical therapy in this setting, we're really looking to how we can rehabilitate our patients through movement and exercise and really prevent any sort of future injuries, as well as assist patients in resuming their daily activities, whatever those activities may be. Occupational therapists also want to use different kinds of treatment to really help you recover, to return to your what we call ADLs, or activities of daily living. It's a lot more of the fine motor and motor function, the small fine motor skills, as well as helping people to be really independent in what they need to do. So there's a lot of overlap, but we treat slightly differently. So next, what we are going to get into is what you are here for, of balance and falls much more specifically. And I'll let Declan cover this.
So this slide is just a little bit about falls, and really all it's saying is falls are common, especially as you get older. Falls happen more frequently, and usually those falls end up in some kind of injury, and in fact you're really lucky if they don't end up in an injury. And that can be anywhere from fractures or up to head injuries, just depending on the fall. But then once you are injured, it's just so much harder to get back to what you were doing, and it really does have an impact on your overall health. It's not just the injury, but just once you stop moving, it's so much harder to get moving again. Yeah.
Okay.
And then this slide is just a little bit about falls. And what it's really saying is most falls are preventable, and that everyone is usually impacted in some way by a fall. And so there's lots of people who need to work together to make sure that we're not falling, and also when we do have a fall that we're working to get back to our previous level of fitness. Consistent exercise is going to be one of the best ways to reduce your risk of falling and improve overall health. And we're definitely going to talk through some specific exercises, but just having a plan that you can work into your routine, even if it's just a walking program, but just staying physically active is one of the best ways to reduce your risk of falling. And it's not just working on balance. Actually, muscle strength and power are important parts of balance, and you should work on all of those together.
So we talk all about falls, and we're always worried about falls and what that can lead to. But the biggest thing is that many falls are preventable, and that's what we really want to talk about today, of the different steps that we can take to help prevent falls. On this slide here, it shows some of the first 3 steps. And number 1 is trying to find just a good balance program and exercise program. There are lots of different agencies and organizations that do have group programs as well as individual programs that they can help provide. This day and age, over the last year and a half, a lot of the programs I know that have existed have changed greatly. Many have been canceled, some have resumed more recently. But the best way to figure out where these are talking to any local senior programs, going through the state and local government, and just finding different resources that way. At the end of this presentation, we'll give you some more specific resources to look towards, but know that there are lots of group and individual programs that you can get involved with to really try and work on your balance if this is something that you are concerned about. Another thing you can do is talk to your healthcare provider, and that can be any of your healthcare providers. They can help direct you in where you think and where they think it would be the best fit for you. If you have a history of falls, it's probably good to come into a physical therapist or some other healthcare professionals where they can do a true fall assessment. Or if you're worried more about just that you might fall and that you want more information and resources, that's when you might want to go to one of those more group fitness classes for fall prevention. The biggest thing is that we get an assessment of your fall risk, and that you share the history of your falls with any of your healthcare providers, because a lot of times we're embarrassed, we don't want to share that information, but it's very important to know because these falls can result in injuries. Another big part to talk about, especially with your healthcare team, is reviewing your medications with your doctor, your pharmacist, and just your healthcare team in general, because lots of times dizziness and alteration to your blood pressure can lead to falls. It can lead to you feeling a little bit more differently than you have, especially if it's a new medication. So really making sure that you're talking with your doctor or pharmacist and talking with how much you should be taking as well, because the amount of the medication you take can also really affect how you feel and all those side effects that you have. So some of the first 3 really big steps is finding a good balance and exercise program, if it's local through your government or any senior citizen programs that we have. Talking with your healthcare provider, just try and see where are you at and where should you be going first, and really reviewing your medications, because a lot of times we don't think about how much our medication can affect us in our everyday life. So the next few big steps are also getting your vision and hearing checked on a regular basis, meaning annually, and making sure that your glasses have your most up-to-date prescription. So Declan mentioned a little bit before, is that balance comes through multiple things. The 3 major parts are what we see with our eyes, what our inner ear tells us and what our joints tell us of where we are in space. So making sure that you get your hearing checked to make sure that if anything's going on in your inner ear, you're aware of it and it can be treated, as well as if your eyes are giving you information that's not perfectly accurate or not perfectly clear, that can affect how steady you are on your feet, as well as what your joints are telling you. Are your feet and ankles able to tell where you are in space? So if you're someone who has neuropathy or difficulty getting sensation through the bottom of your foot, that's going to make it a lot harder for you to keep your balance and maintain your balance. And that's why it's important to get into a program to make sure you're preventing any of these falls. Then we get into just our home environment. Keeping your home safe is a big factor in preventing falls, since most falls do occur at home. So that includes removing any tripping hazards, improving the lighting, and installing any sort of railings or grab bars that you may need. We're going to get a lot more in depth on that later on about what we can do indoors and outdoors, but some of the biggest things are throw rugs. If you have a throw rug and your toe catches the corner of it, or if it's curled up anywhere, that's one part that a lot of falls occur. Lighting, especially at night when people have to go to the bathroom. If you don't have a well-lit area from where you're sleeping to the bathroom, falls occur there where you don't have as much of your eyesight, like we talked about before, how eyesight and your eyes are so important about telling you where you are in space. Then in the bathroom, it's important that if you need, that you have a grab bar by the toilet or in the shower to make sure that you have the safety that you need. In case you're feeling a little unsteady, you can hold on to something that is secure, and it's important that it's installed properly, that it's not going to come out of the wall. And then going back to stairs, always using a railing and making sure your house is just tidied up in general, so there's not different things on the ground, including like magazines, books, boxes, anything that way. And then back to the bathroom, in the shower, having a non-skid mat is going to be really important, because I have seen multiple people who've had slips in the shower. As well as pets. Everyone loves their pet, but sometimes they get caught underneath our feet when we're laying in the recliner or on the couch, that we don't even realize that they're right underneath us, and then you come up and you go to take that first step. I have also seen injuries from people just tripping over their dog that way, which is very, very unfortunate. And then one of the other things that you can do is have an emergency response system. There are lots of systems out there, and these do cost money, but they're all different levels of how much you need. So some are where they have necklaces that you can wear, some are attached to your phone, or other people just keep their phone on them, just in case a fall happens, that you have a way to get someone there to help you. So I know this is a lot of information right now, but we're going to circle back to it again. All right. Now I think it's important for us to go through some different exercises that we can cover. I'm going to attempt to stop sharing the slideshow or change so you can actually see us run through the exercises. So again, if you are not seeing what I'm saying, if you're not seeing us moving around, please let me know. It might take me a second to figure out how to stop sharing everything. Let's see. All right. Okay. So we're going to go through a few exercises. I'm going to come out of the way so you can see Declan moving around a little bit. But the first exercise will be toe stands or heel raises. Everyone calls them slightly differently. And the purpose of this is to strengthen your calves. So the most important thing is that you're by a chair or a counter or some solid surface that will not move on you, because safety is the most important thing. You can stand straight up. Place your hands on the back of the chair and then slowly rise up onto the balls of your feet. Hold for 5 seconds and then slowly lower your heels down to the ground. We want to repeat this about 10 times. You're just going up, holding, and then moving right back down. And again, this is to strengthen your calves. To make this more difficult, because if you can see Declan standing on 2 feet right now, to make it a harder challenge is you can go to standing on 1 foot, still holding on, but then pushing up onto your toes and slowly lowering down. Okay, the next one are called toe taps, and this is just to get some more movement in your hips and improve that range of motion. So you can stand straight, make sure you have your hands on the back of the chair or the counter. You can balance on one foot, and then with that opposite leg, reach your toes out to the side, tap the toe twice, and then come back to the center. And you can do this again about 5 to 10 times, switching legs after you work through that. So make sure on each leg you tap twice, come back in, and repeat about 5 to 10 times. All right. Another one you can do in this position is just working on marching in place. This starts to work on strengthening your upper thighs and improving your balance. So as you can see, Declan has his hands on the back of the chair, but depending on how much weight he puts through his arms, it can make it easier or harder. So if he just has his fingertips resting there, it's going to challenge his balance a little bit more, as opposed to when he has a full grip on the chair. Both are okay. It's truly what's best for you. Safety is the most important thing. So with this one, you're going to lift your legs up, back and forth, where you lift that knee. You can add a hold if you would like for about 5 seconds and then lower back down, alternating side to side. Okay, now we're going to go to some seated exercises. We can turn this chair around. Good. So this one will be what we call knee extensions, and this is to strengthen the front part of your thigh. So you want to make sure you're sitting nice and tall towards the edge of the chair. You have your feet flat on the ground, knees pretty close together, but they don't have to be touching. And then slowly straighten one leg up all the way to the top, pause, and slowly lower back down. We can do this on both sides. You can choose to do all on one side, or you can alternate back and forth. But the biggest thing here is strengthening the front of those legs. Good. The next one will be working on moving from sitting to standing. This is something we do all the time throughout our entire day, but you can turn it into an exercise if you're not using your hands as much to help push up. So again, make sure you're sitting nice and tall on the edge of the chair. Keep your knees hip width apart and your feet flat on the floor. If you need, you can put your hands lightly on your thighs, and you want to use your stomach muscles as well as your leg muscles to lean forward to stand up. If you need, for safety reasons, you can reach back with your hands and slowly lower down, because again, safety is the most important thing. But if you don't need your hands, you can just leave them on your legs or up in the air as you come up and back down. We can have Declan do a few of these, showing if he wants hands on his thighs or arms on the chair, because all of these are correct. It's just what's best for you. You want it to be a challenge, but you also want it to be completely safe. And again, like with all of these, you can do them about 10 times. All right. We'll come back up to standing again, and we'll do a few other ones in standing. So what we'll do next, we'll now try and work on the back part of your thighs, because the first ones we talked through were the front part. Now these are the back. So with the hamstring curls, the part is to stand, again, hands lightly on the chair or counter, whichever you choose, standing tall, keeping your knees nice and close together, and then bending one knee to lift that heel up towards your back pocket, hold, and slowly lower back down. And again, you can alternate legs with this, trying to lift up, pause for a few seconds there, and slowly come back down. And we'll do 10 of these back and forth. Good. So this is all working the back of the thigh. The next one will kind of be working more of those glute muscles, which are right where your back pockets are. This one's similar starting position, hands on the chair or counter, standing tall, and then trying to lift your whole leg backwards, but keeping your knee straight. Your foot will only raise a few inches. We don't have a lot of motion here, so lifting it just an inch or two is perfectly fine. You're going to squeeze that buttock muscle and see if you can hold it this time for a few seconds, and then again slowly lower down. All of these things can be done on both sides to make sure you're working everything equally. All right, and then if Declan turns to the side, we can show an exercise to strengthen the sides of our hips a little bit more. So all these have pretty similar starting positions, but now instead of kicking backwards, you're going to kick your leg straight out to the side and back in. With this one, you're only going to lift your leg maybe 6 inches to a foot off the ground. Again, everyone's hips will move a little bit differently. The most important thing that you can see is that your toe is pointed straight forward, because a lot of times people like to swing their leg and have their toes pointed to the wall away from them. But that's going to work a different muscle, and we want to make sure that your toes are straight forward, so you're lifting up and lowering back down. And again, to add any challenge to this, holding for a few seconds in that position will make it a little bit harder. Okay, we're going to try one now without the chair to see if you can challenge your balance a little bit more, if this is something that is safe for you. So we want to see, you can be near a counter this time, but without holding on. See if you can lift your knee and arm the opposite side at the same time. And we can alternate back and forth. Make sure that you're next to a chair or a counter in case you feel unsteady, that you can always tap your hand there to keep you nice and safe and secure. But with this, it's starting to get more of a challenge since you're not holding on. And I know these are a lot of exercises, but we can always provide handouts later on. All right, so we have 2 more exercises. This is more challenging your balance overall, while the first ones were a little bit more for working on your muscle strength. This one is having one foot put right in front of the other. So thinking about what we call tandem. Again, next to a chair or a counter, but see if you can keep your eyes straight forward, standing up nice and tall, and try and hold this position. To make this also a little bit more challenging, you can try and walk heel toe along the length of a counter if you have that open to you, to see how you feel that way. But just even holding that foot, one foot right in front of the other position, is pretty challenging for your balance. The most important thing is that when you do this, if you're just standing there, that you switch and you give both feet a chance to be in the front and in the back. If you're going to do the walking variation, you want to make sure your movements are very controlled and that you have good balance the whole exercise. And this one is typically better to do by a countertop, because then you can have your hand hovering right over that countertop throughout the duration of your heel to toe walk. The last one we're going to go through will be some single leg balance. So this is a pretty difficult one, but see if you can just do a little finger tap on the top of a chair, lifting one foot in the air and trying to hold that. Keeping your eyes focused on one object will be much easier than if your eyes are moving around or your head is moving around back and forth. And you can see, like Declan did there, if you take your hand away, how long you can hold it for. My goal is that you could probably hold it for up to 30 seconds. But in the beginning, it can be hard even to lift your foot off the ground at all. Okay, so I know that that's a lot of exercises, and we'll kind of get back to the importance of everything in them. But we can sit down, and if you have any specific questions on those, please ask. But why we wanted to cover those exercises today is because those are ones that you can do safely at home, just by a chair or a countertop. If you are not comfortable doing them, see if you can do them with a family member or with other people around, because then you have someone else there just in case you want a steadying hand next to you. Why we want to work on strengthening exercises as well as ones that are just pure balance is because, how Declan said, strength is very, very important in prevention of falls. The stronger we are, the less likely we are to fall, and the more awareness we have of what can cause falls are also very, very important. So I'm going to try and now attempt to put the presentation back up and see if we can continue. But we'll see how this goes. Let's see here. So this is where we left off. So this was that first exercise of those toe stands. So that's to strengthen your calves, where you're pushing up onto your toes and then slowly lowering back down. So all of these are very important, and each exercise addresses a slightly different area. So that first one was to strengthen your calves. So this slide has the next two that we covered, and that was those toe taps out to the side where you're holding on, tapping your toe out and coming back in. That works a little bit on your hip motion, but it also starts to challenge your balance. And that works the muscles on the sides of your hips. Then we get into the marching in place. So this is almost like an exaggerated walking. Every step we take, there's always a little period of time where you're on one foot and then you're on the other. When you march, oh, does it still only show the first slide? Let me see. Does anyone else see the exercises, or is it just showing that one slide? Okay. Okay. Let me know. Please let me know if anyone else can't see the exercises. But this one should show the toe taps and the marching in place. So the marching in place, like I was saying, was the kind of exaggerated walking where you're on one foot for a while and then you slowly switch to go on the other one. This is a good progression to when you're trying to learn to stand on just one leg. Then we get into a little bit more strengthening of the muscles on the front sides of our legs. So those knee extensions, which where you're sitting and kicking up and then slowly lowering your leg back down. So these are all the same exercises that we just demonstrated. Just wanted to review them one more time here. And then moving from the sit to stand position. This one also works the muscles on the front of your legs. It works a little bit through the back, but it's also one of the most functional exercises that you can do. Moving from sitting to standing is very, very important task that we have to do every day throughout our entire day, but it also can become quite a challenge if you push yourself to really start to strengthen these muscles where you might not need to push off the chair. And it's nice to know that the chair has the arms if we need it, but not to have to be reliant on them. Then we go to the strengthening of the muscles on the back sides of our legs, and that was the hamstring curls and the hip extension. Follow up with those side leg raises. So that works the muscles on the sides of our hips. Again, because everything is important. No just one muscle or one muscle group is working when we're moving around. It's everything that has to work all together. Then we started getting into the more challenging just balance activities, and that was that reaching where you're reaching with an arm and the opposite leg back and forth next to a counter or whichever you're next to. So you have a hand there in case you need to tap it to steady yourself, but you really want to make sure you're moving very slowly, that you don't need to use it. And then those last two were what we call tandem, which is that heel to toe position. Seeing if you can hold that. You can take steps walking in that position alongside the counter, or you can just hold that position there. And then the last one was standing on just one foot. And this is one of the most challenging balance exercises. All right, so Declan's going to go through some other helpful preventative tips.
So we talk about addressing falls in the home because most falls actually do happen in the home, and there's some strategies you can take just to make sure that you're as safe as possible. Talked earlier about clutter and just keeping things off the floor, whether that is rugs or boxes or just anything you might trip over, wires. Yeah, I think the plan is to get handouts for people, just so You don't have to memorize all the exercises or anything. And then making sure that there's a phone on each level of the home, just in case you need some kind of emergency. And whether that's having your cell phone with you or having the necklace. I know like the Apple Watches have some kind of fall detection. So just having some strategy and thinking ahead, trying to just make sure that you have a plan for falls. And we don't want falls, but just be as prepared as possible for them. And then setting up your environment to be more safe, especially around the bathroom. You can have grab bars installed, and then the non-skid rugs, just again, setting yourself up to be a little bit more safe. And then when you're using step stools for things that are out of reach, make sure it's sturdy, but also make sure to move the step stool so that you can reach whatever object you're going for without reaching out to the side. And if you can't, if the object's too far out to the side, move the step stool just so you can be safe and stay centered over the step stool. And then again, we talked about vision, and so just turn on the lights when you're getting out of bed at night. You can use night lights just to light up your environment and give yourself the best chance to see what's going on around you. And then taking a second just to orient yourself to what's around you, especially when you wake up in the middle of the night and you're a little disoriented, you haven't had your coffee yet. Just take a second, look around, and this is especially true if you're in a new environment, you just moved, you're on vacation, whatever it is. If it's a new environment, you're not as used to it, take another couple seconds just to look around, see what's around you, and plan how you're going to get over and do whatever you need to do. And then when you're outside the home, you're outdoors, there's just some ways, some strategies to decrease your risk of falls. Looking around you, depending on what the sidewalk looks like, you can see if there's cracks, any uneven surfaces, look for driveway edges, just any obstacles on the sidewalk. And then installing handrails for steps and stairs, give yourself a little bit of balance, but also help yourself to get up the stairs if you're struggling with those. Keeping walkways well lit for clear vision, especially as we get into the cold and rainy months, watching for wet and slippery surfaces, and if there is snow or ice, keep the walkways shoveled and salted. And we wanted to talk a little bit about assistive devices, whether that's a cane or a walker. Really what they're for is, in terms of falls, they can give you a little bit more stability, and depending on how much help you feel like you need, you can opt for a cane or a walker. The walker gives you a lot more stability, but they also decrease the amount of fatigue you have. So if you're feeling tired after walking a couple blocks, adding some kind of cane or walker can help you get a little bit further. And when you are feeling more tired, you are at a higher risk of falling. So using something like any assistive device can reduce your risk of falling. With assistive devices, though, they can be, as long as they're fitted correctly and used properly, they're helpful, but if they're not fitted correctly, they can actually be a little bit more dangerous. So it is helpful to talk to some healthcare provider, whether that's a doctor or physical therapist, talk about what options are best for you, and then also, once you get it, have it sized to you. If you have something like a cane or a walker at home.
So we're going to grab a cane right now so you can see of how it should be set up.
So with it on the ground, just a little bit in front of you, it should come up to about the same height as your watch, right about that wrist area. This one's a little bit short for me, but it's pretty close. So most canes have some way of adjusting them. And so I want to find a good height for you. You should be able to hold it comfortably. Again, you can just use that part of your wrist where a watch would be, give you a little bit of support. And the same is true for when you have a walker. You just want it, the handle to be.
Oh, what was that? Climb up.
Any handle, you just want it to be the same height as your wrist.
So there are lots of different options for assistive devices. Canes, there's various kinds of canes. There's walker, there's various kinds of walkers. And they're different kinds because people need different things depending on what kind of support is important to them and is important for their safety. So there's no one size fits all for canes or walkers. The biggest thing is that, again, talk to your healthcare provider if you have questions about anything specifically. The biggest thing that we want to know is if you do use one, that it should be fitted properly. So that's kind of right to where your watch sits. And that should mean then when you're there, your elbow has just a slight elbow bend to it. Just a slight bend to that elbow so your elbow isn't locked out and you're putting weight straight down. That watch height is the easiest kind of go-to for everything there. So we're going to see if we can go through those resources, both local and through the community. And then please, if you have any questions, just put them in the chat or let us know. All right. So hopefully it should pop up onto your screen soon if it's not there. But these are some local resources that you have within your community that you can use to reach out. This is both within like Snohomish County, or if you're in other counties, as well as throughout the state of Washington. They should have phone numbers, emails if you need, and there are so many more resources than just this. You can talk with friends, family members, or your primary care or other healthcare providers that you might see about if there's anything else that's even more specific to you in your specific community. This is for a little bit more in our area, but there are both regional and local resources. And again, that's for those group fitness classes, individual one-on-one training, or just for fall prevention and more information, things like this that you can find online or other webinars that you can go to. And then the next slide here shows just some other councils or organizations that you can look into if you really want just more information. Our goal is that we can provide you with resources that if you have questions, you know where to go, or if you have more immediate concerns, you know exactly who you can talk to get anything assessed. I know here, or not IRG in general, as well as other clinics, that they do a lot of times of just fall assessments or injury screens. So sometimes we just don't know, do I need this? Is this something I do or don't need? You can come in, we do what's called like a 15-minute just screen. It's an injury screen or a quick fall assessment to determine, is physical therapy the right place for you? Or should you be working on things just within your community if it's going to a different class within a larger group? Or do we think one-on-one training is what is right for your safety and for your future? So every neighborhood and region of the state is slightly different with what they have, but there are organizations throughout. So the most important thing is to reach out if you have any concerns and make sure to disclose your fall history, especially if you have one. So right now we want to kind of open the floor to any questions anyone might have. I know there's some that have kind of popped up throughout. But please ask away, and we're here to answer any and all questions that we can. Okay, I see a few questions trying to come in now. So the biggest thing with fall prevention, and when you start to fall, because I think, John, that's a good question of, if you start to fall, what can you do to prevent any sort of injury that way? The thing is depending on where the fall is, if it's in your home, if there's anything around you, there might not be anything immediately that you can do to fully prevent the fall, but you can see if we can slow it. So again, let me see if I can stop sharing. I still have to figure this out, taking a few times. But the first thing that we try and do is just see if we can move our body side to side to prevent a fall. Then we go to seeing if we can step or reach and grab anything. The thing that can become difficult with that, though, is I have seen injuries where someone tries to grab onto something and then they injure their shoulder from the pulling, or they land and they injure their arm that way. So it really depends on where you are when the fall occurs. But if you do have a fall and you end up on the ground or wherever it is, one of the most important things is to take a second. Don't try and just get up right away. Know where you're at. Give yourself a second to really assess how you feel. Because I have seen a lot of secondary injuries occur because someone fell and then someone else grabbed and pulled them up to standing really quickly. Or they fell and they tried to get up really quickly and then they fell again. The best thing to do is if you fall, give yourself a second. Think about your toes first. Can you wiggle your toes? Second, go to your ankles. How are your ankles doing? Then come up to your knees. You're able to move your legs a little bit. How are your hips feeling? Then go back out. See your fingers. Can I move my fingers? Can I move my wrist? Kind of work your way all the way up through your body. So you do a good, quick assessment of how am I? Should I be trying to get up right now? Because sometimes we need to just stay there and we need to call someone. So if you have your phone or other things or that alert system, we need assistance to get up, because sometimes getting up can lead to further injury. But the biggest thing is that what we can do is try and step or help ourselves that way to prevent falls. But the biggest thing for fall prevention isn't what you do in that immediate second when you're about to fall. It's everything that we can do to prevent falls. And that is through strength, working on balance, knowing your medications, doing those annual exams for your hearing and your eyes, and really talking with your healthcare providers if there's anything else more specifically you need to do for those falls. Is there anything else you wanted to add to that, Declan?
No, I think that just being strong and having options if you're feeling off balance, so that if you do take a step, your muscles are strong enough to support you and bring you back into a more comfortable position. But yeah, it's prevention and have strategies just in case it does happen and to be able to deal with it.
But the biggest thing is, yes, we can try and find a way to get some of this information back out to you so you can go through all these exercises, because all of these are for you to do on your own if you feel safe doing them. The hardest thing is if you don't feel safe. Then that's when it's important to contact someone, do a fall assessment and see, is it just because you haven't done it before that your body's a little nervous to try it out? That's completely fair. Or is there a deeper dive that needs to be done to make sure we prevent any of these falls? So it looks like, Lisa, I saw that you had mentioned that you have had two falls this summer? So that's a big thing just to say that you've gone through that, because it means that you're aware that this is something that you probably have to work on. And I do know that we have a few therapists. We have a clinic in Anacortes and another one in Oak Harbor. So depending where you live, I actually know a few of the PTs up there and they're wonderful. So if that's something that you think is important to have an assessment, I would really reach out to your local office or go into your primary care provider to see, are there any other things that you need to do? If it's looking at your medication, if it's other hearing and vision related things, or is it more exercise, strength, and balance that we need to work on?